Listen, thank you all for being here with us today, and to this austere group, thank you all for coming and joining us. Well, I'll tell you, if there was ever a matter of life or death, this issue that we're dealing with today, Jane, is that, over the last several years, there's been a lot been made about a federal government and their steady intrusion into all facets of our daily lives, whether it was how we educate our children, how we run our business, what sort of light bulb you can have in your house. And one of the most intrusive and one of the most costly of those intrusions, and I might add the most personal intrusion, Senator, has been in the area of health care. In the terms of economic effect of Obamacare, it will be devastating all across this country, but for Texas alone, we will be required, it's estimated, to bring $27 billion more to the table over the next 10 years, starting in 2014, to cover the cost of the expanded caseload. On a personal level, I happen to think Obamacare unconstitutionally punishes Americans who don't want to buy health insurance. Again, this is only the latest example of overreach from this administration, and overreach that is sparked and sustained. I guess it's sparked and sustained by this unguided notion that Washington knows best about everything. Well, in Texas, we know better. We know that states require the flexibility to solve local problems in their own ways, reward innovation, discourage redundancy and waste. That's why we're here today to sign Senate Bill 7, a collection of measures that are an answer to what's wrong with the federal health care system. It provides some $467 million in savings while improving health outcomes to Texans. SB 7 provides flexibility through a variety of measures that opens the door to effective, innovative solutions Washington hadn't thought of, while containing cost, keeping the well-being of Texans square as the primary goal. It also provides the framework for the establishment of new collaborations between healthcare providers and payers, greatly improve the coordination of care by aligning incentives with quality outcomes. Additionally, the bill transforms our Medicaid and our CHIP program, those reimbursement models, to one that rewards innovation, cost efficiency, and performance. This legislation will also help us take a step closer to joining a state compact, which is a significant way for us to minimize the effects of the coming catastrophe that will accompany the full implementation of Obamacare, if that is not stopped first. So a compact with other states will enable additional levels of flexibility in the administration of health care programs, flexibility that's simply impossible under the federal program. And along those lines, SB 7 calls for the development of new Medicaid waiver program, giving us options in, or I should say, giving us options in the design and the eligibility side of things that could save us significant amounts of money while continuing to ensure the best health care possible. Additionally, this bill also helps protect those who need our protection the most, and that is the unborn, underscoring our ongoing commitment that taxpayer money may never be used for abortions. The unavoidable fact is that Texas faces challenges very unique when it comes to healthcare delivery. And Washington's one-size-fits-all approach simply does not fit our specific needs. SB 7 gives us the flexibility to develop our own solutions to these challenges. And when it comes to meeting challenges, I'd waver, or I should say I would wager on the side of Texans and their innovation every time. So I want to call up the author of SB 7, a senator who has been in the trenches helping develop the most capable health care bill I think that's been passed in some time, Senator Jay Nelson.
Thank you. Thank you. Governor, thank you for signing this bill into law and for your support and leadership from day one on this very important piece of legislation. This is an omnibus health care bill that's going to help us meet several goals that we established prior to the regular legislative session that we just completed. We had an interim study leading up to this. This includes many of the recommendations from that study. It combines both 7, 8, and 23 bills from regular session. It ensures that we live up to our responsibility to those who depend on state services and to those who support these programs with their hard-earned tax dollars. Going into session, we knew that we were going to have to address some of the issues that the governor just mentioned to eliminate the waste, the fraud, the inefficiencies. We knew that we had to come up with additional resources, and Governor, you stated, almost $500 million. We know that that's what was in the fiscal note on the bill. We're going to save at least that much. We anticipate more like $3 billion that we will be able to see as a result of doing some things that are done in this bill. Waste, fraud, inefficiencies. We're going to focus on seeing healthy outcomes instead of the process. We know that it's not a one-size-fits-all, and that's why we're so happy to see this as the Texas answer to how to address our health care needs. I'm not going to go into the details, but I will tell you that this is doing things differently than we've done them in the past. And we would not have been able to come up with these solutions without the input from a lot of people who are in the trenches, some of whom are over here today. Our providers, Joel Allison, I shouldn't name names, but Joel with Baylor Healthcare System, as well as other hospitals, were involved from the beginning to make sure that we did it right. We had, and Dr. John Flores with Denton County Medical Society, I'm not biased, is here, but the physicians, the providers were with us, helped us through the process. We had the pro-life provisions were mentioned. Diane Edmondson, Carol Everett, Joe Poyman are here today. They were an important part of developing this legislation, and the most important partner is standing right next to me, Dr. John Zerwas, and of course the doctor by his name. I never know whether to say doctor, chairman, representative, or chairman, representative. Dr. Zerwas is a physician, has been a physician for more than 20 years. He practices anesthesiologist at Greater Houston Anesthesiology, helped started that 10 years ago. I've got a huge bio here. He's awesome. He is on the Appropriations Committee as chair of the Health and Human Services Subcommittee. He's a member of Public Health, and I have never had a better partner on any legislation I've ever carried in the Senate. I mean, we made a mean team. I think this bill is going to have a significant impact on how we as a state provide health care to our citizens. And Dr. Zerwas, I am so grateful for your partnership.
Thank you, Senator, for that, and Governor Perry, thank you for your leadership on this piece of legislation, which is an omnibus health care piece of legislation. Originally a fiscal matters bill, and it was a fiscal matters bill in the regular session. It was a fiscal matters bill in our special session, but it was a bill that, by virtue of its importance, also attracted everything in healthcare, from the beginning of life to the end of life, and all the fiscal matters that are important to us that the governor and the senator have already articulated for you. What I will say is that anything this large does not happen without the input of many, many different people involved in the healthcare industry, and those have been very well articulated by the governor and by the senator. We don't get to good places in healthcare legislation until we as a governing body sit down and listen to everybody who is involved in the delivery of health care in this state. And I'm very thankful that those people did step up and help us craft something that I think will have monumental changes in the delivery of health care for the state of Texas. And it will be particularly unique to the state of Texas, which I think is what is incredibly important. I can't thank the governor enough for his leadership and his vision of wanting to see something like this happen. And the senator, goes without saying, in my book, she's the best to work with. And if it was not the strength that she showed and the resources that she had within her staff and the ability of my staff to work with her staff and all that goes along in between there, this would not have happened. And so to them, I give them great thanks for doing this, and look forward to seeing the effects of this very important legislation in the next years and decades to come. Thank you very much.
Before we sign this piece of legislation, I want to take a moment and Dr. Zerwas, just making an observation and listening and thinking while you were making your appropriate remarks. The Texas legislature is a microcosm of our state, and all too often there are areas of expertise that sometimes are lacking in our legislature because of the intensity and the time requirements of coming and being a part of this process or running for office. And healthcare is one of those. And all too often through the years, we haven't had a physician standing on the House floor, working with the members of the legislature, giving them real-time information. And I just want to say thank you for your sacrifice. I know it's a big deal to walk away from the practice of medicine, which you've done often, but you have served this state greatly. Speaking of serving the state greatly, Tom Cease, I want to say thank you for being here today and the work you do, and now all you have to do is go implement it. That's the easy part. Super all good. Come on over here. Yeah. Y'all pull up here close. Come on, Doc.
Cuddle in, cuddle in.
Get in here. We got it. Yeah, get back here behind. You can stick us there. Way behind back
That's
there.
going to be tough. You make us want to see this outside.
Anyway, let's look right there, and we'll get our picture first. Great. Great, that's awesome. Senator?
Thank you.
Again.
Thank you. I got a collection.
You did.
Thank you.
Thank you. Yes, sir. God bless you. Appreciate you. Thanks. You're welcome.